Hello, you're tuned into daily coronavirus updates. Today is the 5th of May and you're watching The Wire. As per latest data, over 42,000 people have been infected by the novel coronavirus in India. Over 11,000 people have been cured nationwide and 1,389 have died. 2,553 people were reported positive in a single day. Globally, the number of infections due to the virus have crossed 30 lakh. Across the world, the death toll stands at 2,47,000. As India entered its third phase of the lockdown, the union government made prior arrangements for stranded migrants, students and tourists to return to their native states. But after the order issued on May 2 on the same, another order issued on the 3rd of May created quite some confusion. The union government issued a clarification that the earlier order does not extend to those categories of persons who are otherwise residing normally at places other than native places for purposes of work, etc., and who wish to visit their native places in normal courses. The new order has confused state governments who do not know which migrant will be allowed to return and which one won't. Rajasthan and Jharkhand government officials told The Wire that they were trying to break their heads to understand what this means, and such micromanaging by the centre is not helping anyone. In what is being described as a political masterstroke, the Congress on Monday said that state units will bear the cost of rail travel for all needy migrant workers and labourers stranded at their workplaces due to the coronavirus-induced lockdown. The interim president of Congress, Sonia Gandhi, said this in a statement. She added that this would be Congress's humble contribution in standing shoulder to shoulder with these workers. Her statement accused the central government and the railways of completely ignoring the demands made by the Congress for ensuring the safe and free travel of migrant workers and labourers to their homes. In the daily press briefing that happened on the 3rd of May, Love Agarwal, the Joint Secretary of the Health Department, said that special trains have run because the state governments requested the centre for it. On being asked why the rail travel was not free for workers, he said that railways will bear 85% of the cost of transportation and the states will bear 15%. However, no official notification for this has been issued and journalists are questioning the authenticity of this statement. According to a News Minute report, the BJP's claim of 85% subsidy could be based on a technicality. A source told the digital news website that normal fares charged by railways is about 50 to 55% less than the actual cost of the journey. Further, because social distancing norms have to be maintained, these special trains have only 54 people per coach instead of 70 to 72 in normal times. It's like that the BJP is considering this as an 85% subsidy from the centre's side. How the citizens of the country will see it is a different question altogether. The controversy around the efficacy and the pricing of rapid test kits has encouraged government agencies to look for other testing methods. Multinationals such as Abbott Healthcare and Roche Diagnostics have received approval to import kits that use technology other than rapid antibody tests and rely on immunoglobulins. The Drug Controller General has given the nod for this move. Some of these new kinds of kits will use chemiluminescent platforms, while others would use ELISA platforms. These two platforms are primarily different types of antibody tests. A senior health ministry official told state media ANI that in a move to increase the current testing capacity for COVID-19, orders have been placed for close to 63 lakh RT-PCR testing kits. Companies in South Korea, Germany, the USA and China will be supplying these RT-PCR kits to India. Health officials estimate that the first batch of kits should arrive in India after the 10th of May, and the rest will be supplied in a phased manner. Earlier, at least 5 lakh rapid antibody test kits were imported from China, some of which were reporting inaccurate results. A 34-year-old doctor has been booked for allegedly sexually assaulting a 44-year-old male patient of COVID-19 in the ICU ward of Wockhardt Hospital in Mumbai. The police have said that the accused has not been questioned or arrested due to the fears that he may be infected by the novel coronavirus. Instead, the police said that they have placed the accused in quarantine inside his home. The hospital, meanwhile, has sacked the accused and the services of the doctor have been terminated too. Earlier this week, Padmani Singh, the Secretary of Health and Family Welfare Department of the Delhi government, asked medical directors of various government hospitals to get written explanation from doctors who have tested positive for the virus, asking them how, in spite of wearing protective gear, maintaining social distance, and following precautions, they still contracted the infection. Responding to this, Dr. Adarsh Pratap Singh, the president of Resident Doctors Association at AIIMS, has called this an insensitive move. He said that doctors testing positive is a worrying trend. Singh blamed the government for failing to provide basic facilities and services to healthcare professionals in various hospitals. Singh and other doctors have listed 10 demands and asked the government to take urgent steps: inadequate infection prevention, training of healthcare workers in many districts, and non-availability of PPE kits to doctors treating non-COVID patients are some of the concerns raised by him. Over 500 medical staff and 40 journalists in Pakistan have been infected by the coronavirus. According to official data, 503 medics, including 250 doctors, 110 nurses, contracted the deadly virus while treating COVID-19 patients. Most of these infected doctors and nurses belong to the Punjab province of Pakistan. New Zealand has recorded no new cases of the coronavirus for the first time since March 16th. According to the country's health ministry, there were no additional virus-related fatalities and the death toll remained at 20. The total number of confirmed cases in the country is only over 1,000. Thank you for tuning in. Keep reading The Wire and The Wire Science. We will see you tomorrow. Until then, stay safe.